Members from all across the House of Commons voted for a 988 National Suicide Hotline. BC MP Todd Doherty joins us to talk about it. It's James with Net News Ledger. Eric Melillo isn't able to join us this week. Tod Doherty, who is the Member of Parliament from up in northern BC and Prince George area, has decided to step in and help for that talk this week. Welcome.
Hey, it's great to be here. Thanks for all you're doing.
You're in a beautiful part of British Columbia up in the north, similar to the Thunder Bay area and the northwestern Ontario region in a lot of ways, little taller mountains.
Yeah. You know what? This is home for both my wife and myself, both raised in the region here, and my wife's family have been around for time immemorial. Her great grandfather actually settled one of our hometown, Williams Lake, as he was the judge, the hangman, and the banker, all during the gold rush.
Wow. The issue that you've been really working on over a long period of time was to create 988, a national suicide hotline.
Mm-hmm. Yeah, for a time long ago, I worked with at-risk youth and young adults, worked in First Nations communities as well, suicide prevention and crisis intervention, and really took my passion for doing everything in our power to remove the barriers for mental health and reducing the stigma to my political career. And in the last session, we managed to pass a piece of legislation as an opposition member, making Canada the first country in the world to adopt a federal piece of legislation to combat post-traumatic stress disorder. And then we followed it up with this session, a motion to bring a simple 3-digit national suicide prevention hotline to Canada. We know that when minutes count, simple 3-digit number will save lives.
No, it's ironic. I was researching for the story. I went and looked up, some of the numbers, and there's like 1-800 and I thought, boy, if somebody is struggling with suicidal thoughts or anxiety or problems, mental health problems, they're not going to remember a number like that. But we all know what 911 is, and we all know what 211 is. So now we just have to further educate on 988 and make that happen in lots of ways. One of the questions I have is, this is a new process to create a merging of all these numbers. So if someone were to call 988, what would happen?
So we have a patchwork quilt system of crisis lines all throughout our country, and you're absolutely right. In some communities, in some areas of our country, there aren't these services. So what the idea is, and what has been taking place behind the scenes, is kind of an amalgamation, bringing all of those numbers and all of those agencies under one roof, and expanding to the areas where, like our rural and remote and our Indigenous communities where there are no services, to bring it under one roof and one simple 3-digit number, and that's the concept behind 988.
So this would be accessible toll-free anywhere that someone has access to a phone.
Absolutely.
Now, one of the areas, and I'm going to bring things into a Thunder Bay perspective, even though you're not from here, but a Northern Ontario perspective, one of the issues that we're really battling with here is homelessness. We have a large issue with addiction. So we end up with people who are on the streets and may not have easy access to a phone. What can be done in cases like that?
Well, again, I think what we do is, we know that many of those that are on the streets that are homeless or have addictions, the root cause of that or a component of that is mental health challenges. And so what we want to be able to do is make sure that wherever they're receiving services, that those people, that those grassroots organizations that are on the ground there to support those that are struggling, that they have a simple 3-digit number that they can access to provide help for those that need it the most.
That's a good start. I think that our readers and viewers need more information on this, and how do we share that? And then, what we're seeing across Canada is even the simplest things like a phone booth.
Mm-hmm.
That, growing up, I remember here's a dime, call someone who cares, sort of thing, as a joke, or here's a quarter, call someone who cares, the country song. We've got to now where, finding even just a payphone is almost impossible. So that's one area that probably needs a little bit of extra work.
Yeah, COVID has really shone the light on a couple things. One is the prevailing mental health crisis and addictions crisis that we had leading into COVID. And the other part of it is Canadians' ability for connectivity or access to connectivity and internet access, making sure that wherever we are within our great nation, that we have access to those services, whether it's internet, mobile phones, cell service. Just in my neck of the woods here in northern British Columbia, you don't have to go too far out of our major city to have little to no cell service. And that is, as you know, in our rural and remote communities, that just leads to further isolation, which then leads to serious mental health challenges. And, one of the very first debates that I took part in when I was first elected was the suicide epidemic in Attawapiskat First Nation.
Yes.
And absolutely tears my heart out. When you have children as young as 6 that are, that figure that their only way out of their lot in life is death. And so we need to do everything in our power to connect these communities, to know that they're part of a greater nation, and that help is available when they need it.
The issue of internet is just so huge. Even for our weekly call with Eric, we've had times where the internet just packs up on us.
Yeah, I'm in, just in, Prince George, having been here and done some work in Prince George. I'm not outside of Prince George. I'm in a neighborhood in the urban area, and our internet is very spotty at best.
It's something that that's the biggest thing in the pandemic. And I'll ask you the question, do you think all of these gaps that we're seeing, do you think that the federal government is doing everything that it can as quickly as it can?
Well, the simple answer for that is no, which is why, 154 days ago, I tabled our motion to bring 988 to Canada, and Parliament, the members of Parliament, unanimously supported that. And here we sit 154 days later, nothing has been done. We know that the CRTC is considering investigating it. Now, James, I'm going to put those numbers in perspective for you. We know that every 24 hours, 11 Canadians will take their own lives. And we know that there are further 275 attempts. Those numbers right there, using just those stats and timesing it by 154 days, that is 1,694 Canadians we have lost, and a further 42,350 that have attempted to take their lives. Now, what's staggering by those numbers is that those are pre-COVID statistics. The other staggering part is that suicide is the second leading cause of death for our young children. Now, again, that is a pre-COVID statistic. We know that COVID has had an unbelievable impact on Canadians' mental health, increased anxiety, isolation, substance abuse, domestic violence. All these rates are up. Suicidal ideation and crises are up. We've got to do something. And a critical part for our country and our nation's recovery has to be a strong mental health component in there. There's no health without mental health. And
yes,
James, I'll give you an example. If I, if I broke my arm or broke my leg, it's a visible wound. People would be clamoring to come and help me. But if I came forward and said I was struggling with mental illness, or I just wasn't feeling right, because of the stigma surrounded that, people are kind of hands off, and we have to do everything in our power. And we know through statistics that through traumatic events, the full realization of the impact of those traumatic events may not even be felt for 3 to 5 years after that event. And so as a nation, it's incumbent on us to act now. And just recently, as recent as the other day, I tabled my bill 294 to make sure that Canadians and this government can just simply act. And it all it does is it puts into force, it changes the Telecommunication Act by one line. It just amends one line, and it says the commission shall designate within 1 year after the day in which this section comes into force a three-digit number dedicated to suicide prevention services. It's so important that we act now because we don't have time. We're going to come out of this, and we need to be ready for the onslaught of mental health.
That, sometimes decisions made by government at all levels don't seem to fully understand the impact that those decisions make if you delay.
Yeah, 100%. And I get emotional when we're talking about this. Honestly, it makes the difference between life or death. I just had a constituent message me last week, and her name's Michaela, and Michaela was very upset. She was heartbroken, and her father, 53 years of age, just couldn't take it anymore, and took his life. So here's a young girl, prime of life, 22, 23 years of age, having to deal with the death of her father, the loss of her father. And those are the realities. We get these messages every day. And, I sit on the Veterans Affairs Committee, and, the bureaucrats don't like me because I bring these very real messages. And I know my colleagues, Eric Malillo is doing a fantastic job for his constituents, raising these issues every day. I know my colleagues from all sides of the House are getting these same messages. And I just, legislatures and Parliament is filled with studies that collect dust. We don't need to study this anymore. We need action. I think Parliament would be a far better place in terms of public approval if we just acted. If Canadians saw more action and less talk or less studies.
I don't think anybody's going to argue with that. We see that with the Truth and Reconciliation report. We see that with the MMIWG report.
Yeah.
These are real problems that real Canadians are facing and trying to overcome. And kind words are nice. But, if you were drowning and someone said, well, you look good, that's not going to do anything for them.
No, I challenge my colleagues all the time. If you knew today you could save a life, would you? Because we have the power to do that. We have the power to be able to leave a legacy of action. Sadly, I think that the bureaucrats get in the way, and political ideology gets in the way. And I just think that we have to be better. We have to be better for Canadians.
Maybe there needs to be a motion in the House of Commons to change question period to answer period.
Yeah, I'm with you on that. Absolutely.
Because that's the thing. I mean, what we're seeing so often I've often thought, and I to be honest with you, it's 25 or 30 years in politics. I think if a member of Parliament stood up and asked the Prime Minister, what's the weather like today? Often the answer is, I feel fine. And if the supplementary was, how do you feel? He'd answer that it was a sunny day. And, preset questions that, they're almost like, it's like an act and it's theater. And it's real lives that are being impacted every day. We're dealing with situations here in Thunder Bay today. They're starting construction of a water park, which is supposedly going to have an Indigenous theme. In the middle of the park is a tree where a young girl committed suicide. And has been where her mother's been going to meditate and to connect with her daughter and to grieve. And this thing passed at City Council with almost no, with COVID, everybody's focused on other issues, and it just went through. And now they're building the construction has started. And now there's people saying, okay, well, what can we do to stop this? And you know how bureaucracy works. They've already got a contract issued. They've got all the plans made. And it's going to be probably impossible. But it's going to create some real angst for that mother.
Yeah, my heart goes out to the family. And it never gets any easier when you're dealing with the loss of somebody that took their life. It was I was 14 when my best friend took his life. I was the last person to see him, and I think about him every day, and I wish I had the opportunity to replay that night over. And I definitely tell him that I loved him and that my world was a better place with him in it. As we get older, I think that that sense of loss. I also lost my brother over 20 years ago to drinking and driving. And they say time heals all, and I really have a hard time with that, because for me, that wound and that loss just gets greater, because I think we know what we're really missing as we get older.
That's where the importance of what you've been working on is right there. And I want to thank you for sharing that with our readers and viewers, Todd. That's a powerful message.
I really appreciate this time. James, I've been to Thunder Bay. I was part of the Aboriginal Sports Circle hockey camp back in, I think, 2004. And we were at Lakehead University, and what a beautiful community you have.
Thank you. And we'll keep in touch on this issue, because I think we have to keep educating Canadians and people across Western and Northern Ontario and beyond on it. So thank you very much, Todd.
James, thank you again. And thanks for this conversation. We have to keep talking about this. We have to bring this discussion into the homes and across our nation.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.